Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we are going to see about the antidote for poisoning. So there are various poisoning which we come across in our clinical experiences. But it is very difficult for us to remember those antidotes for the poisoning. For certain poisoning, we can remember the antidotes by using its pronunciation and by simple tricks. If you want to know about those tricks, kindly like it, share it and subscribe it, and don't skip the video. And without wasting much time, let's get started into the video. So before telling about the antidote, we must know what is antidote is. Antidote is a substance that can counteract the form of poisoning. The antidotes are particular toxin are manufactured by injecting the toxin into the animal in small doses and extracting the resulting antibodies. So by this only we get the as a result of antivenoms and all. So by injecting the toxin into the animal, if we are injecting some toxin, means what happens, the body will automatically produce those antibodies. So we are extracting such antibodies from the animals and we are using for the treatment purposes. So first one is acetaminophen, for example paracetamol. For sometimes what happens, if we are giving the high dosage of paracetamol like acetaminophen, what could be the antidote is N-acetylcysteine. So acetaminophen, acid, you just remember acetaminophen, acid, in the same pronunciation we have antidote of N-acetylcysteine. So next is organophosphorus poisoning, organotropin. Organophosphoropoisoning, in the same way you have to pronounce the atropine. So the counteract drug for the poisoning organophosphorus is atropine. Next is heparin. For heparin, the antidote is protamine sulfate. That means heparin, protamine. So again you repeat, heparin, protamine. So for the heparin poisoning, what could be the antidote we have to give? Protamine sulfate. So sometimes in cardiac vascular diseases we have to administer the heparin. So sometimes what happens, there is a chance of over toxicity. So in that cases we can give protamine sulfate. So next is warfarin. So warfarin, in the same pronunciation we have antidote vitamin K. For warfarin, what is the antidote is vitamin K. So next is morphine. So in the alphabet order, after M, N comes, right? So for morphine, next the antidote for morphine is naloxone. For M, after M, N. So morphine, naloxone. Next is flumazenil. The antidote is benzodiazepine. So flumazenil, Z, zenil. So in the same pronunciation we have a benzodiazepine. So next is lead poisoning, and for lead and iron poisoning you have to by heart certain words, but for previous poisoning we can identify with the help of pronunciation. So for lead poisoning we have to administer dimer-captosuccinic acid, and for iron poisoning we have a deferoxamine mesylate. So next is for beta blockers plus calcium channel blockers poisoning, we have an antidote of insulin plus glucagon. So certain antidotes we have to by heart it, and certain antidotes we need not by heart. By using certain tricks, with the help of the pronunciation we can easily understand it. Okay, so far we have seen certain antidotes. So sometimes what happens, if we don't know what poisoning has occurred, so we suddenly they will bring a patient telling that he ate something, it is a poison, we don't know what poison is. So in that cases what we do administered is, we administer the activated charcoal. So why we administer this activated charcoal? It delays the poisoning absorption. Okay, so it will delay the absorption of those poisoning into the bloodstream. So in that cases, so most of the oral poisonings we can give the activated charcoals. So next is, only this much antidote is available? The answer is no, exactly no. So there are various antidotes for the various poisoning, but here we have discussed only very few which is being repeatedly asked in the competitive examinations, and very common poisoning we have seen. So we will see the part 2 video. If antidote is not available, yes, in this world there are various animals and insects where we do not have the antidote for that, but in that cases what we can do is, so sometimes an animal has bite a person, we don't have the antidote for that particular drug, means there will be an anaphylactic reaction, right? For that anaphylactic reaction we can administer injection adrenaline, that is epinephrine. So if the antidote is not available, in that cases if a person is exhibiting any anaphylactic reaction, that anaphylactic reaction can be reduced by administering what drug? Yes, injection adrenaline or injection epinephrine. So that's all about today's video. The part 2 video will be uploaded soon, and stay tuned into this channel. If you like this video, kindly like it, share it and subscribe it. If you have any doubt, kindly drop down in the comment box, and thank you for watching.